Hello, how you doing? My name is Devae Freeman, and I completed my respiratory therapy visitation there at Northwest Hospital. My experience there was way more than what I expected. I think in the best way possible, though. I went in thinking I'd get a simple overview, respiratory is this, respiratory is that. But I walked out with way more information than what I came in with. Um, my favorite part of the day, good and bad, but the most exciting part of the day was actually seeing a respiratory therapist at work. Um, a patient got put on BiPAP, so we got to see the process of all that. Watching her prepare the machine, calibrate the machine, apply the mask correctly, teach us about the skin checks, everything like that. Getting to see live hands-on um, and like what the job really is and what it entails was probably the best part for me because it wasn't just book information. Um, my least favorite part of the day was understanding how short-staffed respiratory therapy can be. How therapists can be short-staffed a lot of the time, and sometimes the workload isn't intentional, but it just happens that way. Um, but that was the my least favorite part, which is seeing how bad it could be if push comes to shove. It just shows me how the proper staffing like really matters. But one of the few things I learned was how the workflow is. Every therapist starts with an assignment, specifically at Northwest when I was there. It's all color coded. Orange is assignments are for patients using the Drager ventilators. Purple is for the high flow oxygen patients, and blue is for the BiPAP. So they have it all color coordinated. So it's very easy for you to come in, take a look, see where everybody's at. It's easy to manage that way. Learn to restock supplies. The therapist before you should have you restocked, and you should also thoroughly restock for the therapist coming in after you. So it's like someone always picks up like where the other person left off. 9:30, go over any updates. You have a huddle, talk about things throughout the hospital, talk about things with specific patients, things that might have just happened. It just gives you a chance to really, you know, um, have everybody there to speak to people directly because everybody's all over the place. Um, Learned a lot about ventilated patients. Sitting them upright is essential, especially if they're trached. I learned that the ER respiratory therapists, they work in the ER the whole time, but they have to assist with PACU again, specifically at Northwest. They spread the workload to prevent any burnout. During code, message was simple. Everybody needs to go. If you're available, go. All hands on deck. Um, it's important. Communication is very important. Also, building a rapport with the nurses, building a rapport with the doctors and your coworkers, like keeps things running smoothly. Keeping a calm attitude, matters in this job. It's a lot of pressure and everything. So, I asked Miss Sarah about bounce back patients and like what's the main reason why people, come back once they're cleared to leave. She said a lot of them, chest pains, a lot of smokers, things like that. So one thing that she reiterated was when you have a patient, smoking, for instance, you never just tell them to stop. Like, yeah, it's not good for you, but you never tell them to go cold turkey. Instead of telling them things like just quit, re-educate them. Let them know the risks and the like realistic steps, if this does keep happening or if they do stop. So yeah, re-educate always. Never tell them, what and what not to do. Learn about the ventilators. The Hamilton C1 has high flow BiPAP, standard ventilator. Great for patients who use high flow during the day, BiPAP at night, and it's very easy for transport. The Drager is the main ICU ventilator. Perfect for patients moving from ventilation to high flow nasal cannula. So we looked at all those different machines, figured out which ones were good for which. BiPAP is for sleep apnea. CPAP is for BiPAP is used for COPD, and CPAP is for sleep apnea and stuff like that. So we learned about glidoscopes, everything like that. So it was a lot of information, and looking back on the whole day, she told us at the very end was always be confident, always have a voice, be confident in yourself. We learn the information, use it. Don't be afraid to ask questions. And at the end of the day, we left with keychains and we left with snacks. So it was a very informative day. I appreciate everyone that I got to speak to, and I appreciate the opportunity to be able to have this visitation. So thank you.